Good morning. Today I'll be speaking to you about polycystic ovarian syndrome in the context of using the ketogenic diet. So PCOS for short is a condition that afflicts many women across the world and many women in the United States. It's associated with a number of hormonal derangements that causes excessive cystic growth on the ovaries and will often result in a lot of hair growth, excessive hair growth that we call hirsutism in medicine, and acne, obesity, menstrual irregularities, and some infertility. So it's a very disabling condition and it afflicts many women. And it's associated with, like I said, the hormonal imbalances with estrogen, progesterone, with excessive amounts of testosterone and high levels of insulin. So most of these women have pre-diabetic state, and some of them do later develop type 2 diabetes. And so in looking at the evidence and studies that have been done in women with this condition, the ketogenic diet has been successful not only in causing weight loss in these women, but also in correcting some of the hormonal imbalances with markedly reduced hair growth, as well as the ability to fall pregnant. So it has been safely done in these women, but I will admit that there are some challenges to high insulin states in general, whether you're diabetic or whether you have polycystic ovarian syndrome. Having high insulin is associated with excessive amount of cravings. And so getting off sugar and transitioning to ketones is a little bit more challenging in these women. And most of them will experience those first few days to 2 weeks of what we call the keto flu, making it so hard to stick to the routine. But knowing that they can get past it and can get past it safely, it is important that these women have either nutritional coaches or experienced dietitians, coaches, or clinicians that can help them get past those initial 2 weeks, because it's exceptionally difficult given that you still have a high insulin state and a lot of craving. So you truly go through what we call a withdrawal state. So to the women that have reached out to me and asking whether PCOS is a reason not to try the keto diet, it is certainly not a reason not to try the keto diet. It is safe to do. It has certainly been shown in multiple studies to be very effective at correcting some of those hormone imbalances, and could potentially save women from being on a multitude of medications, both to try and suppress certain hormones, as well as trying to later fall pregnant. So speak to your clinician about this to make sure you've gotten clearance before you embark on such a journey. Hope this is helpful. I am Dr. Madeline Chatahombi, and here to answer questions on the ketogenic diet. Take care.